Good evening. I'm Brittany Mosier, and tonight with two of my fellow classmates, Cindy and Lena, we will be discussing the differences between CDIP, CHPS, and CHDA. With health information management profession growing vastly, new roles are emerging and becoming specialized. The American Health Information Management Association offers many specialty certifications. However, we will only be discussing these three. With clinical documentation on the rise due to the implementation of ICD-10-CM, the Commission on Certification for Health Informatics and Information Management through AHIMA developed a certification exam for clinical documentation improvement. CCHIM defined the roles and responsibilities of clinical documentation improvement practitioners to create the exam, which is 140 questions and 3 hours in length. The CDIP credential acknowledges those individuals who successfully pass the exam and holds competency in clinical documentation improvement to warrant quality patient health information. There are 6 domains in which the CDIP candidates are tested on. These 6 domains include clinical and coding practice, leadership, record review and documentation clarification, clinical documentation improvement metrics and statistics, research and education, and compliance. Through job analysis surveys, it was identified that clinical coding practice and record review and documentation clarification made up nearly half of the CDIP exam due to their high importance in the field. According to AHIMA, individuals who are eligible to sit for the CDIP exam must meet one of the 2 requirements. The first is that the individual must already possess a credential in Registered Health Information Administration, Registered Health Information Technology, Certified Coding Specialist, Certified Coding Specialist Physician-based, Registered Nurse, Medical Doctor, or a Doctor of Osteopathic Medicine, and have at least 2 years of experience in clinical documentation improvement. The second criteria is that an individual must have at least an associate's degree, which must include coursework in medical terminology and anatomy and physiology, and have at least 3 years of experience in clinical documentation improvement. For an individual with a CDIP credential, the average
You need to start over.
No. Sorry. After receiving the CDIP credential, the individual is required to obtain continuing education units and must pay a $150 recertification fee every 2 years. The amount of CEUs depends upon the type and amount of credentials held. For CDIP, the individual must accrue 30 CEUs. When an individual does not meet the renewal requirements in the time frame allocated, they lose their certification. For an individual with a CDIP credential, the average salary range is between $60,000 and $80,000 per year. And now I'm going to turn it over to Cindy, who will provide you with information on CHPS.
Thank you, Brittany. My name is Cindy Karstens, and I'll be talking to you tonight about CHPS certification. What is CHPS? It is an acronym for Certified in Healthcare Privacy and Security. The CHPS certification is offered by AHIMA as an advanced certification. The CHPS credential symbolizes that the professional is trained on implementing and maintaining a comprehensive privacy and security program for the organization, which is an important step in protecting against inappropriate access, breaches, or disclosures, which carry high-tech penalties of up to $1.5 million. The pathway for attaining the credential requires the candidate to meet one of the following eligibility requirements before taking the exam. Number 1, an associate's degree with 6 years experience in healthcare privacy or security management. Number 2, Healthcare Information Management Credential, RHIT, and a minimum of 4 years of experience in healthcare privacy or security management. A bachelor's degree and a minimum of 4 years experience in healthcare privacy or security management. Health Information Management Credential, RHIA, and minimum of 2 years of experience in healthcare privacy or security management. A master's or related degree and 2 years experience in the healthcare privacy or security management. AHIMA certified professionals are required by the Commission on Certification for Health Informatics and Information Management to participate in mandatory baseline education courses to earn a predetermined number of CEUs, continuing education units, for each credential or combination of credentials. The required number of CEUs for maintaining a CHPS credential depends upon the number and type of AHIMA credentials the professional has acquired. For example, the number of CEUs required for recertification for an RHIT is 20 CEUs, plus 10 CEUs for the CHPS credential. One can receive AHIMA CEUs by attending an AHIMA event, complete an AHIMA online education program, complete an AHIMA journal quiz, complete an e-assessment, and so forth. The CHPS credential represents competency in designing and administrating privacy and security programs in all types of healthcare organizations. The type of positions that may employ an individual with this credential are privacy officer, HIPAA privacy officer, Health Information Management Manager. Being distinguished with this advanced credential demonstrates a commitment to advancing privacy and security management practices. Healthcare security and privacy specialists are employed to make sure that patient rights are not ignored by either human or computer. They also ensure that institutions are in compliance with other regulations under the HIPAA Act. Average salaries with the CHPS credential can range from $65,000 to $78,611. The salary range would also take into consideration other factors such as education level, experience, and any other credentials the candidate maintains. Now I would like to introduce Lena, who's going to discuss with you the CHDA. Thank you.
Hi, this is Lena Reyes, and I'm going to be talking about the Certified Health Data Analysis certification. The Health Data Analysis certification is viewed as an expertise in health data analysis. They are responsible to acquire, manage, analyze, and interpret data to convert it into useful information. CHDA use software and statistics to provide data support, perform research, and improve information quality and accuracy. This data is organized through the use of computer-based applications to promote more efficient patient care, as well to reduce costs for the organization. They are also responsible to report to high-level management in managing a budget. The Certified Health Data Analysis professionals should have good skills in Microsoft Excel, data analysis, structured query language, as in statistical analysis software. Most of the CHDA professionals work full-time positions at hospitals and home healthcare agencies. Also, they need at least 2 years of healthcare work-related experience. Some experience can be acquired in positions like medical economics, health information technology, and medical office administration, where they can get experience in software and data management skills. With this experience, they can get jobs as a certified health data analysis at health benefits or data information companies, as well as state public health centers. To be certified as a health data analysis, the candidate must meet one of the following requirements: Health Information Management Credential, RHIT, and a minimum 3 years of healthcare data experience, a bachelor's degree in healthcare administration, and a minimum of 3 years of healthcare data experience, a Healthcare Information Management Credential, RHIA, a Master in Health Information Management, HIM, or Master or higher degree, and 1 year of healthcare data experience. The American Health Information Management Association offers the National Certified Health Data Analysis Certification Examination. The candidate or the participant can apply for this exam submitting a paper application or register online. This exam includes area or cover areas of data management, data analytics, and data reporting. These tests include 150 multiple choice questions, and it costs to members of AHIMA $259 and non-members $329. If the participant failed the test, he or she can retake the test after 91 days. Also, to maintain the Certified Health Data Analysis credential, the participant needs to acquire 30 CEUs every 2 years. To receive AHIMA CEUs, they should attend to AHIMA events, complete online education programs, or participate in any quality CEU activities. Plus, also, the participant will pay a fee of $150. According to the Bureau of Labor Statistics 2014, the average annual salary of health data analysis in United States is close to $80,000. The mean hourly wage is $38.46. In Gainesville area, the hourly wage is $33 to $41, which is close to $60,000 annually. However, this salary may vary according to the professional experience and software skills. In summary, the CDIP, CHPS, and CHDA are all different credentials offered to AHIMA. Each certification provides new jobs opportunity for the participants who pass the certification exam. According to the Bureau of Labor Statistics 2014, these certifications are projected to grow 34% from 2014 to 2024. These certifications provide a great opportunity for HIM professionals due to the industry growing need for improved healthcare. Each of the discussed credentials allow for improved interpretation of data, clinical documentation, and privacy and security to provide quality care for patients. Thank you very much. I hope everyone enjoyed this presentation. Thank you.